Are you having trouble with a child or a teenager? Well, it could be more than just a simple behavioral problem.
Yeah, they could be suffering from ADHD, but what are the signs and the symptoms to be on the lookout for? So here to tell us more about that is Susan Angel. She's with CNS Healthcare. So hey, Susan, thanks for joining us again today.
Good morning.
Let's talk about ADHD for a second. So what are we looking for in this specific trial?
Well, specifically, we're looking to contact folks who may have some questions about whether or not their kids have ADHD or not, or some may have considered having a medication holiday for their children over the summer, which again is there is some positives and negatives, to that. And so we're just kind of asking folks to take a look at their kids and see what's going on with them. If they've previously been diagnosed, is their medication effective? Is it doing the trick for them? Have they been off medication for the summer? Or are there some kids who are having problems at school, problems at home that may not be under treatment but are looking for some treatment?
So if a parent is watching right now, what are some of the signs and symptoms that they need to be aware of to think that their child might possibly have ADHD?
And for us particularly right now, we're looking for adolescents between the ages of 13 and 17. And sometimes their symptoms are a little bit different than what you would see in a kiddo, smaller child. Because the teenagers, while they still have problems with attention, they still have problems with concentration, distractibility, that type of thing, they also start having some impulsive behaviors. And these impulsive, risk-taking behaviors can really cause them some problems, at school, at risk for accidents, substance abuse, those types of things.
Did you say that parents take a vacation kind of from medication for kids with ADHD during the summer? And do you advise that, or what are the advantages of that?
Well, it's, like I said, there's positives and negatives.
Yeah.
And it depends. Some kids take medication like Vyvanse or Concerta, which is a stimulant medication. You can stop that and then start it, and the effectiveness comes back, pretty quickly. But some of the kids take medications like Strattera, Capvay, and Tuniv that take longer to get into the system and affect change. So it's more difficult, to pull those kids off and start them right back up because it takes longer to affect. The other issue you have is like where some kids who may just have inattention, that subtype of ADHD, they'll do fine, when they're out of school. But then the kids who are hyperactive, impulsive, and they're not on medication, so everything you were trying to do to contain it is back in full force. And unless you've got really good structure at home and some good organizational strategies, all those difficulties can come back.
So how can CNS help people who might need some help out there?
We're looking at a medication for teenagers to see if it can help their attention and concentration, and we have the clinical trial process in place where, of course, if you have insurance, fine. If you don't, fine. There's no charge, no sorts of fees associated with it. But what we'll do is they'll come in and we'll complete an assessment on them, and we'll kind of run through the diagnostic criteria for ADHD to see if they meet that diagnostic criteria. And then they can have the option, if they do, to participate in the clinical study, or we can help connect them in the community with appropriate referrals.
So if their child or teenager is experiencing the symptoms that we looked at earlier on the screen, and they want a free trial, basically is what this is, right? It's totally free. They don't have to have insurance or referral. They can just come to CNS Healthcare. You guys will run them through an assessment, and then what's the next step?
Then if the assessment, if they meet criteria, then we'll schedule them for a longer appointment with the physician and the nursing staff. And what they'll do then is they'll do even more detailed diagnostic workup. They'll look at lab work, ECG, vital signs, trying to rule out any underlying medical cause that may contribute to the symptoms. And if not, there's nothing medically underlying it, then we'll move forward with the clinical trial, and then they'll begin taking a medication.
And ADHD is just one of the clinical trials that you guys have. You're doing a lot more in addition to that.
Right, and specifically for our pediatric population, we've got a pediatric depression as well as the ADHD. We're also starting an autism trial as well with people who have not only autism but Asperger's or pervasive developmental disorder. For adults, we have bipolar disorder, depression, as well as medical related trials for pain, specifically chronic lower back pain, hypertension, diabetes, and irritable bowel syndrome, as well as sexual dysfunction related to side effects of antidepressants.
So really anyone with symptoms is a candidate?
Particularly, yeah. They can come in and have an assessment, and we're continually looking for new studies that could help the population here, and there's other studies upcoming as well.
All right, Susan, thank you so much. We appreciate it as always being here. We want to thank CNS Healthcare, of course, for sponsoring this segment.
Yeah, to find out if any of their trials might be right for you, call 904-281-5757 and just make an appointment. It's a free 30-minute evaluation session. You could also log on to their website, that's cnshealthcare.com. And remember, all of those services are free. No referral or insurance is even needed.